Okay, let's unpack this. There's this common threat hiding out there, often just waiting in the grass. And for our canine friends, it can carry something truly serious. We're talking about ticks and a potentially devastating disease known as Rocky Mountain Spotted Fever. Welcome to the deep dive. So we've taken a real deep dive into this specific topic using these detailed clinical guides you gave us and, the kind of stuff aimed at vets. Our mission here is to cut through all that density, pull out the absolute most vital information. We want to give you the core knowledge you need to understand canine RMSF, why it actually matters for the dogs in your life, and importantly, what the science from these sources tells us about recognizing and dealing with it. Think of this as like your shortcut to being well-informed about this specific risk.
And it's important, I think, right up front to connect this to the bigger picture. While it's definitely severe and potentially life-threatening in dogs, this disease also has a significant zoonotic potential, which basically means it's not just a dog health issue, it's directly relevant to human health, too. So this information is really valuable for you, especially if you spend time outdoors with your dog.
Absolutely. So let's start with the absolute basics then. What exactly is canine RMSF?
Okay. At its core, it's a tick-borne disease. It's caused by a specific type of bacteria called Rickettsia rickettsii. And the key thing about this bacterium, according to these sources, is that it's an obligate intracellular bacterium, which means essentially it has to live and reproduce inside the host cells to survive and, cause the infection.
Okay, and where specifically does it like to set up shop once it gets into a dog?
Yeah, this is really critical to understanding why RMSF causes the signs it does. Rickettsia has the strong preference for endothelial cells. That's the delicate layer of cells lining the inside of blood vessels throughout the whole body. It invades and replicates right inside those vessel lining cells.
Right. Okay, here's where it gets really interesting regarding how it gets around. The ticks that spread it. The sources named the main culprits in North America. You've got the American dog tick, Dermacentor variabilis, that one's widespread, generally east of the Rockies. Then there's the Rocky Mountain wood tick, Dermacentor andersoni, predictably found in the Rocky Mountain region. Right. And notably, the brown dog tick, Rhipacephalus sanguineus, that one's found worldwide, but it's a primary vector in the southwestern U.S. and Mexico. The brown dog tick is particularly interesting because it's often linked to transmission happening inside or right around homes and kennels, what sources call paradomestic transmission. There's also a note in there that novel vectors might be playing a role in the disease expanding to new areas. Could be other ticks getting involved.
Right, and understanding the transmission timing is pretty important for prevention, too. The sources indicate that typically an infected tick needs to be attached for a period, generally somewhere between 5 and 20 hours, to actually transmit the bacteria. However, there's this fascinating detail mention that some studies suggest transmission could potentially happen in as little as 10 minutes. That's if the tick has recently fed on another host just before biting your dog.
Wow, 10 minutes. That's fast.
It is. Transmission can also happen, though less commonly, via contact with tick saliva or blood, maybe during removal, or even through a blood transfusion, though that's rare.
So where is this most likely to be a concern, geographically speaking? While cases are reported across the lower 48 states, the sources really emphasize that over 60% of reported cases are concentrated in the southeastern states, specifically listing North Carolina, Oklahoma, Arkansas, Tennessee, and Missouri.
High-risk areas.
And there are also distinct patterns, particularly in Arizona and northern Mexico, linked to that brown dog tick. There, cases can actually occur year-round, and the incidence and, unfortunately, fatality rates can be higher.
Yeah, that brown dog tick scenario is a bit different.
Tick season typically runs from, say, late March to the end of September, but obviously that varies regionally. And while the bacteria are out there, the overall infection rates in ticks themselves are generally quite low, usually less than 2%. Though, again, that figure also varies by location.
And this is where we connect right back to that human health aspect we mentioned earlier. Dogs are often considered sentinels for human risk, meaning if dogs in a certain area are getting sick with RMSF, it acts as a really important warning sign. It tells us the bacteria are circulating in that local environment, which increases the risk for people living or visiting there, too.
That's a crucial point.
It is, and it's absolutely vital for listeners to understand this. Direct dog-to-human transmission of the bacteria is not reported. You won't get RMSF just from petting or being near your sick dog. However, as we touched on, humans can become infected through contact with the tick's fluids, its blood or lymph, especially during the tick removal process. If you have broken skin on your hands or you touch your eyes or mouth afterwards, that's the risk. So this is a key point for your safety when dealing with ticks on your dog.
Okay, so let's dive into what this all means once the bacteria successfully makes its way into the dog's body via that tick bite. What happens then?
Well, remember those endothelial cells we talked about, the ones lining the blood vessels?
Yeah,
That's where the action happens. The bacteria invade and then they start replicating inside these cells.
and that process causes damage, I assume.
Exactly. The bacterial invasion and replication directly damage these blood vessel lining cells. It's what's called a direct cytopathic effect. And this damage triggers a widespread inflammatory response in the blood vessels themselves. We call this vasculitis, basically, inflammation of the blood vessels.
Vasculitis.
Okay.
That sounds pretty serious. How does that damage then lead to the signs we might actually see in the dog?
It is serious. This widespread inflammation and damage make the blood vessels become leaky. They lose their integrity. So fluid, proteins, even red blood cells can start seeking out of these damaged vessels into the surrounding tissues.
Ah, okay. And that leakage is then the root cause of things like swelling and bleeding.
Precisely. When fluid seeps out, you get edema, or swelling. It's often particularly noticeable in areas like the face, the ears, or the limbs. And in male dogs, swelling of the scrotum or the prepuce can be quite prominent. That's a key indicator noted in the sources. And then the damage and fragility of the vessels, combined with problems with clotting, also leads to hemorrhage bleeding. This can show up as petechio. Those are the tiny, tiny pinpoint red spots. Or ecchymoses, which are larger, more like bruise-like areas.
Where would you typically see those?
They're often easiest to spot on the oral mucous membranes, like the gums, also the whites of the eyes, the conjunctiva, the ear flaps, the pinnae, or areas of non-pigmented skin, like the belly or the inner thighs.
Gotcha. And one of the hallmarks the sources really seem to highlight is thrombocytopenia. That's a low platelet count, right? Platelets being essential for clotting.
Yes, absolutely. Thrombocytopenia is very common and a really important finding in RMSF. It happens for a few reasons, really. Platelets get consumed, kind of used up during the body's response to all that widespread damage in the blood vessels and activation of the clotting system. Platelets can also get trapped or sort of stuck in the damaged small vessels. And one source even mentions the possibility that the dog's immune system might create antibodies against its own platelets, further lowering the count.
So because these damaged, leaky, clot-prone blood vessels are literally everywhere in the body, the disease can potentially affect almost any organ system.
That's absolutely right. The widespread vasculitis and the formation of tiny clots within the vessels, that's called microthrombosis, can impact organs that have a really rich blood supply. Think kidneys, brain, heart, lungs, liver, spleen.
Wow.
Which is exactly why the clinical signs of RMSF are so incredibly varied. They can look like so many different problems. It makes it tricky. And in the most severe, often untreated cases, this uncontrolled damage and clotting cascade can lead to a really life-threatening condition called disseminated intravascular coagulation, or DIC.
DIC, right. I've heard of that. It sounds bad.
It is. It's where the body is paradoxically forming abnormal clots and experiencing excessive bleeding at the same time, basically because all the clotting factors and platelets are getting used up. It carries a very grave prognosis. Other severe outcomes like shock and dangerously low blood pressure, hypotension, are also noted in the sources as possibilities.
And meanwhile, the dog's body is trying to fight this off, but the bacteria are kind of hidden away inside the cells, which makes it a tough battle for the immune system.
Exactly. The host definitely mounts an immune response, but accessing and eliminating bacteria that are busy replicating inside your own cells is a significant challenge.
Okay, this next section is crucial for any dog owner listening. What does RMSF actually look like? The sources really hammer home that the signs are, well, all over the map, highly variable.
They truly are, and that's a huge part of why recognizing it requires vigilance from both owners and vets. Signs can be really mild, almost unnoticeable, or moderate or extremely severe, and often they're nonspecific, meaning they could point to lots of different illnesses. This really highlights the absolute need for a high index of suspicion, especially if you are in or have recently traveled to an area where RMSF is common, or if you know for sure your dog has had tick exposure.
Okay, so let's walk through some of the common things an owner might actually observe based on what these sources say.
Right. Well, you might notice general signs first. Fever is common. sometimes quite high up to 105 degrees Fahrenheit, potentially. Lethargy, depression, just generalized weakness, and a loss of appetite. Vets call that anorexia or inappetence. Those are frequently seen. Just generally feeling unwell.
Pain and stiffness seem to come up a lot, too.
Yes, pain is often a significant feature. This could be just generalized pain all over, or specific muscle pain, myalgia, or joint pain, which we call polyarthritis or arthralgia. Stiffness when walking, especially if there's that swelling around the scrotum or prepuce in male dogs, that can be a clue.
And those hemorrhagic signs we talked about, the bleeding. Where should people look?
Yeah, that's a key area, driven by the damaged vessels and those low platelets. Petechia, remember, the tiny pinpoint spots and ecchymoses, the larger bruises, are really important clues. Check the gums, the whites of the eyes, inside the ear flaps, and any non-pigmented skin like the belly or inner thighs. One source specifically notes that ecchymoses are seen in roughly 20% of cases.
Okay.
More severe bleeding can happen too, like nosebleeds, that's epistaxis, bleeding in the back of the eye, retinal hemorrhage, or even blood showing up in the stool or urine.
And the swelling, the edema.
That can affect the face, the ears, the limbs, and again, that prominent scrotal or preputial swelling in males is a notable sign mentioned.
Okay. What else?
Well, you might feel enlarged peripheral lymph nodes when petting your dog that's lymphadenopathy, and it's quite common. An enlarged spleen, splenomegaly, is also sometimes found on exam by the vet.
Gastrointestinal signs.
Yep, GI upset like vomiting, diarrhea, and maybe abdominal pain can occur.
And respiratory, like breathing issues.
Possibly. Coughing or difficulty breathing, dyspnea, can happen if the lungs are affected by the vasculitis and that leakage. You might notice your dog tiring more easily or breathing heavily after just a little exercise.
Neurological signs seem pretty serious, too.
They are, and they can be seen in up to a third of affected dogs, often indicating more severe disease, unfortunately. This could look like altered mental status. Maybe the dog seems dull, confused, maybe wobbly, ataxia, or even unresponsive in severe cases. Signs of inner ear disturbance, vestibular dysfunction, things like a head tilt, repetitive eye movements called nystagmus, or just general incoordination.
Seizures, too.
Seizures are possible, yes. Also, pain along the spine when touched, muscle tremors or weakness in certain facial nerves, neck pain, cervical pain is also noted.
In the eyes.
Yeah.
Beyond just the bleeding.
Right. Besides retinal hemorrhage, you could see red eyes conjunctivitis or what's called scleral injection. Also inflammation inside the eye, uveitis, or even inflammation of the optic nerve.
What about skin signs like a rash?
Well, while a rash isn't typically as prominent or obvious as it is in humans with RMSF, those tiny red spots, petechiae, or bruises, ecchymoses can be seen. They might just be subtle in dogs with lots of hair. In very severe cases, unfortunately, necrosis, actual tissue death of the extremities, like the tips of the ears, tail, or toes, can develop. That's called a Krull gangrene.
Grim.
It is. And in acute severe cases, the disease can progress really rapidly, leading to dangerous heart rhythm abnormalities, potentially sudden death, or just quick progression to that DIC state and death from shock.
And the sources mentioned that if it's left untreated, this illness can just kind of linger for maybe 2 to 4 weeks.
Yeah, it can be a prolonged illness if not addressed.
Okay, so recognizing these really diverse signs and getting a diagnosis quickly sounds absolutely essential. What does that process typically involve?
It really is essential. It's basically a puzzle your veterinarian has to put together. It always starts with a high index of suspicion based on your dog's signs and their history. You know, where have they been? Have they definitely had tick exposure? What kind of tick control are you using, if any? Then a thorough physical exam is crucial, paying really close attention to those areas prone to swelling, bleeding, or pain that we just talked about: gums, skin, lymph nodes, joints.
And then lab tests come in.
Right. Initial lab tests provide supporting evidence, though they aren't usually definitive for RMSF on their own. On a complete blood count, a CBC, low platelets thrombocytopenia, is very common and a real key indicator. The platelet count can be severely low. One source mentioned thrombocytopenia in around 40% of cases, sometimes linked to those antiplatelet antibodies we discussed.
Okay.
You might also see changes in the white blood cell count, sometimes an initial drop, followed by an increase as the disease progresses, often with signs that the neutrophils are working hard, what we call toxic changes.
What about the blood chemistry tests?
Those are often less specific to RMSF itself, but they can show signs of organ damage or just general illness. You might see low protein or low albumin levels because of that vascular leakage. Signs of kidney issues like azotemia or increased liver enzymes are possible. Electrolyte imbalances are pretty common too. And interestingly, high cholesterol, hypercholesterolemia is often consistently found. Why that happens isn't fully understood, but it's a noted finding.
Urinalysis. Anything there?
A urinalysis might show protein in the urine if the kidneys are affected, or blood if there are bleeding issues from the vasculitis or low platelets.
Okay, so those are suggestive. What about tests that actually confirm RMSF?
Right. For confirmation, specific tests are needed. Serology, which measures antibodies in the blood, is the most common approach. The indirect fluorescent antibody test, or IFA, is generally considered the gold standard. This test looks for antibodies against Rickettsia rickettsii, both early ones, IgM, and later ones, IgG. The most definitive result, the gold standard confirmation, is seeing a four-fold or greater rise in the IgG antibody levels between two samples taken about 2 to 4 weeks apart. So you take one sample during the initial illness and another one during recovery. If that titer jumps up significantly, that's strong evidence.
What if you only get one sample?
A single high IgG titer can be suggestive, especially if the clinical signs are really pointing strongly towards RMSF. But here's perhaps the most crucial takeaway from the diagnostic section for you as an owner, and the sources absolutely stress this. Serology tests, the ones looking for antibodies, can often be negative in the early stages of the infection, usually during the first week or so. That's because the dog simply hasn't had enough time to develop a detectable level of antibodies yet.
Okay, that's huge.
It is. And this is why prompt antibiotic treatment should absolutely not be delayed while waiting for serology results if your veterinarian has a strong suspicion based on the clinical picture and the tick exposure history. Waiting for that confirmation could literally be the difference between a good outcome and a poor or even fatal one.
That's a critical message.
Definitely. It's also worth noting that antibody tests can sometimes cross-react with other related bacteria, other Rickettsia species, and high antibody levels can stick around for up to a year after the dog has recovered.
Are there other specific tests mentioned?
Yes, a few others. There's ELISA, which is another type of antibody test that might detect infection a bit earlier than IFA alone because it measures both IgG and IgM. Then there's PCR, which looks for the bacteria's actual DNA. This can be run on blood, tissue like a skin biopsy from a lesion, or even spinal fluid, CSF. PCR can potentially be positive earlier than serology, but its sensitivity varies. So a negative PCR doesn't definitively rule out infection either, and sometimes it might detect DNA from dead bacteria. One source mentions that PCR testing is available from North Carolina State University specifically.
Okay.
There's also immunohistochemistry, IHC, or direct immunofluorescence. These tests look for the bacterial antigen directly in tissue biopsies, like from a skin lesion, useful if lesions are present or even for postmortem diagnosis. Actually, culturing the bacteria is not routinely done. It's difficult to grow and requires special safety precautions.
And because those initial signs are so varied and nonspecific, I imagine the vet has a list of other things it could be.
Exactly. Differential diagnoses are really important here. Your vet will be considering other potential conditions that can look very similar. Other tick-borne diseases are definitely high on that list, especially ehrlichiosis, which can have many overlapping signs like fever, lethargy, low platelets. Co-infection with multiple tick diseases is also quite possible.
Right.
Immune-mediated diseases are another big category. Things like IMT immune-mediated thrombocytopenia, where the body attacks its own platelets, or immune-mediated polyarthritis can mimic RMSF signs, especially the low platelets or the joint pain. In some tricky cases, a vet might even start treatment that covers both RMSF and potential IMT right off the bat.
Makes sense.
Other possibilities include things like leptospirosis, severe bacterial infections or sepsis, certain poisonings like rodenticide, systemic fungal infections, and even some types of cancer like lymphoma or hemangiosarcoma. Brucellosis is mentioned too, particularly because it can also cause scrotal swelling.
Okay, lots to consider. But the good news in all of this is that there is effective treatment, but it really sounds like timing is absolutely everything.
It truly is. Prompt antibiotic treatment is the absolute cornerstone, and it should begin immediately based on a strong clinical suspicion without waiting for those test confirmations that can take days or even weeks.
So what's the go-to antibiotic?
The drug of choice, according to all the sources, is doxycycline. The typical dosage range is 5 to 10 milligrams per kilogram of body weight. It can be given either by mouth, PO, or intravenously, IV, usually every 12 to 24 hours. The duration is typically somewhere between 14 and 21 days. But the key rule is to continue treatment for at least 3 to 5 days after all the clinical signs have completely resolved.
How does it work?
Doxycycline works by inhibiting the bacteria's ability to make proteins, which they need to survive and replicate, and it's highly effective against these intracellular rickettsias.
What about side effects? Is it safe, especially for younger dogs? There used to be concerns about tooth staining.
Yeah, that's a common question. Generally, for the doses and durations used to treat RMSF, doxycycline is considered safe even in young animals. The risk of permanent tooth discoloration is low, with the relatively short-term use needed here. One source specifically mentioned a common regimen being 10 milligilograms by mouth every 12 hours for 10 days, or switching to IV for 5 days if the dog is vomiting and can't keep pills down.
Are there alternatives if doxycycline isn't an option for some reason?
While doxycycline is strongly preferred, other options are mentioned, but usually with more cautions. Tetracycline is an older drug in the same class. It might be less expensive, but it's definitely avoided in puppies under 6 months because of the tooth staining risk, and also usually avoided in dogs with kidney problems. Chloramphenicol is another one mentioned as being effective against the bacteria in the lab. However, it's generally not recommended clinically. There are concerns about higher fatality rates seen in humans treated with it, and it has the potential for serious side effects like bone marrow suppression in dogs.
Okay, so generally avoid that one.
Generally, yes. Interestingly, one source does mention it as a possible alternative specifically for puppies under 6 months old at a dose of 20 milligauge Q 8 hours for 14 days, precisely to avoid the tooth staining issue with tetracyclines. But it stresses the need to warn clients about potential public health risks, like handling the drug, and its effects on blood cell production. So it's used cautiously, if at all.
Any others? What about common antibiotics like fluoroquinolones?
Fluoroquinolones, like enrofloxacin, are shown to be effective experimentally in lab settings, but doxycycline remains the preferred choice clinically. That's due to its proven track record, safety profile, and the added benefit that it often treats common co-infections, like Ehrlichia, that might be present. Plus, fluoroquinolones carry that risk of cartilage damage in growing dogs.
Okay, so doxycycline is really the main player here.
It absolutely is.
So beyond the antibiotics, what kind of supportive care might a dog need, especially if you're really quite sick?
Right. Supportive care is absolutely vital, particularly in moderate to severe cases where the dog is really debilitated. Fluid therapy is often crucial for dehydration or shock, but vets have to use conservative fluid rates. Because those blood vessels are so leaky, giving fluids too aggressively can actually make things worse, potentially leading to fluid building up in the lungs or the brain, causing pulmonary or cerebral edema. So balanced electrolyte solutions are used carefully.
Makes sense. What about blood products?
Yes, if there's significant bleeding causing severe anemia, blood transfusions might be necessary. And for severe bleeding due to those critically low platelets, platelet-rich plasma or whole blood transfusions can sometimes help provide clotting factors and platelets.
Other supportive measures?
Definitely. Medications to control vomiting, diarrhea, or abdominal pain are often needed antiemetics, GI protectants. Nutritional support is important if the dog isn't eating on their own, maybe through a feeding tube in severe cases. Pain relief analgesia is also given for that muscle and joint discomfort.
What about steroids, like prednisone, sometimes used for inflammation?
That's a good question. Corticosteroids are generally not needed as a routine part of RMSF treatment because the antibiotics themselves typically resolve the underlying inflammation quite effectively. However, they might be considered in very severe, rare situations, say, if there are confirmed immune-mediated complications happening alongside the RMSF, or maybe severe brain inflammation, meningoencephalitis. But crucially, this would only be after antibiotics have been started and the infection is presumed to be under control. And they're used with caution because steroids can potentially mask signs of lingering infection.
Okay.
And if that really serious clotting and bleeding disorder, DIC, develops, that requires aggressive critical care in a hospital, setting fluids, potentially plasma transfusions to replace clotting factors, all while continuing to treat the underlying RMSF infection.
The sources also stress the importance of monitoring patients while they're undergoing treatment, right?
Yes, close monitoring is absolutely key, especially for hospitalized patients. One source specifically recommends monitoring platelet counts maybe every 3 days until they return to the normal range, which should actually happen fairly quickly. Once effective doxycycline treatment starts, typically within 2 to 4 days, you should see those platelets coming back up.
Good to know.
Severely ill dogs will likely require inpatient hospital care until they're stable, eating, and showing clear signs of improvement. And restricting the dog's activity level, keeping them quiet, is also important during the recovery phase.
So after all of this, recognizing the signs, getting the diagnosis, starting treatment, what's the usual outcome? This is probably the biggest question for listeners whose dog might be affected. What's the prognosis like?
Yeah, that's always the main concern, isn't it? The
Hmm.
prognosis for dogs with RMSF is generally considered good, but that comes with a very important condition, provided they receive prompt and appropriate treatment, specifically with doxycycline.
So early treatment is key for a good outcome.
Absolutely paramount. If the disease is diagnosed and treated early, ideally within the first few days of signs appearing, most dogs respond very rapidly to the doxycycline. You often see a significant improvement, sometimes dramatically so, within just 24 to 48 hours of starting the medication. And another piece of good news is that dogs who have been naturally infected with rickettsia and have recovered are generally considered to acquire lifelong immunity. They're unlikely to get RMSF again.
Okay, that's reassuring. But what if treatment is delayed?
That's where the prognosis shifts. If the diagnosis and treatment are delayed, or if the dog is already severely ill with significant organ damage before treatment begins, then the prognosis becomes much more guarded, potentially even poor. Severe complications like multi-organ failure, kidney or liver failure, severe neurological signs. And unfortunately, even if they survive severe neurological involvement, some residual deficits, like wobbliness or seizures, may persist long-term. Uncontrolled vasculitis, clotting disorders like DIC, or that severe tissue death, acral gangrene, these can all be fatal.
Do the sources mention fatality rates?
They do. The estimates suggest that even with treatment, tragically, somewhere between 1% and 10% of dogs diagnosed with RMSF may not survive, and without treatment, that figure would be significantly higher. One source really stresses that if treatment isn't started until neurological signs are apparent or very late in the disease course, the mortality rate is very high and death can occur rapidly, sometimes within hours. If there's confirmed central nervous system disease, the prognosis is generally considered poor.
What about recurrence? You said lifelong immunity is usual, but can a dog get it again after recovering?
Relapses have been reported, though rarely, sometimes after what seemed like a completed course of treatment, but actual recurrence of RMSF itself is considered rare because of that strong acquired immunity. If a dog who previously had RMSF develops similar signs again months or years later, the vet would probably be looking strongly at other potential causes, or perhaps co-infections with other tick-borne diseases that weren't addressed initially.
Okay, so prevention is clearly paramount then, both for the dog's health and, as you mentioned, potentially for ours too. How do we protect our dogs based on what the sources tell us?
Effective tick control is absolutely the cornerstone of prevention. It's the most important thing you can do. The sources list several key strategies.
Let's hear them.
Okay, first and foremost is the year-round, consistent use of effective tick prevention products. This includes topical, spot-on treatments, oral medications, or tick collars that are proven effective. It's especially critical if you live in or travel to areas where ticks and RMSF are known to be common. Don't slack off in the winter months in many areas.
Makes sense. What's next?
Second, perform thorough tick checks on your dog daily, particularly after they've been outside, even if it was just a quick walk in the local park or playing in your own yard. Remember, ticks generally need some time attached to transmit the disease, so finding and removing them quickly is really vital. Check between toes, in ears, under collars, everywhere.
And if you do find an attached tick,
Right. Then prompt and proper removal is key. The recommended method is to use fine-pointed tweezers. Grasp the tick's head as close to the skin as possible, right where it's attached. Then pull straight upward with steady, even pressure. Don't twist or jerk. Try to make sure you remove the entire tick, including the mouth parts embedded in the string, to prevent local skin reactions or infections later.
and you mentioned a safety point for humans here earlier.
Yes, absolutely crucial. Wear gloves when you're removing ticks from your dog. Disposable gloves are ideal. This helps protect you against potential exposure to the tick's fluids, its blood or lymph, which could potentially transmit the bacteria to you through tiny breaks in your skin, or if you accidentally touch your eyes or mouth during the process.
Good reminder. What about the environment?
Environmental control can also help reduce the overall risk. Managing tick populations in your yard or kennel area can make a difference. Things like keeping the grass mowed short, removing brush piles and leaf litter where ticks like to hide. In some high-risk situations, using appropriate tick control products, acaricides, in the yard might be considered. However, one source does realistically remind us that complete tick eradication is basically impossible. The bacteria persist in wildlife reservoirs like rodents and other animals.
So avoidance helps too.
Definitely. If possible, limit your dog's exposure to areas known to be heavily infested with ticks, like dense woods or tall, grassy fields, particularly during peak tick seasons in your region. Stick to trails.
Okay, and one final question on prevention. Is there a vaccine?
That's a common question. Currently, the sources are clear. There is no vaccine available specifically for Rocky Mountain spotted fever in dogs. Prevention relies entirely on tick control and avoidance.
Okay, so to wrap up this deep dive into canine Rocky Mountain spotted fever, it's definitely a serious illness transmitted by ticks, caused by this tricky bacterium that attacks blood vessels. But the really important takeaway seems to be that with prompt recognition and, crucially, early treatment using doxycycline, the prognosis is generally good for most dogs.
Absolutely. Maintaining that high index of suspicion, especially in endemic areas, knowing the potential signs, even the vague ones, and empowering your vet to start doxycycline based on that suspicion without necessarily waiting for potentially delayed test results. That's key to a successful outcome. And just to reiterate, aggressive year-round tick prevention is not just about protecting your dog's health from RMSF and other tick diseases, but it's also a critical step in protecting yourself and your family. Specialists often get involved in managing the most severe, complicated cases and also play a big role in educating owners and the veterinary community.
So what does all this detailed information really mean for you, the listener? Well, knowing these key signs, understanding the risk factors in your area, knowing not to wait for tests before treatment if your vet strongly suspects RMSF, and of course, implementing consistent, effective tick prevention strategies. All of this empowers you to act quickly and decisively to protect your dog and also reduces your own potential exposure. Knowledge really is power here.
And maybe if we connect this back to that bigger picture for a final thought to mull over, consider how your dog's health, potentially acting as that early warning system or sentinel for tick-borne diseases in your specific neighborhood or region, is directly linked to the tick population and the overall disease risk in your local environment. It really highlights this fascinating and sometimes concerning interconnectedness between the health of our pets, our own public health, and the ecosystems we all share. It's not just about one dog getting sick.
A very important perspective. And that concludes this deep dive.